screens. Dr. Nicholas Kardaras is now warning parents about the effects of all of that tech time, calling it digital heroin because of the way children can get addicted. Dr. Kardaras joins me now from Boston. He's the author of Glow Kids, How Screen Addiction is Hijacking Our Kids and How to Break the Trance, a digital drug, electric cocaine. Doctor, these are some strong, strong words. Tell us what the latest research says about the effect of too much screen time is having on these young minds.
Right, and just so you know, and by the way, thank you for having me, Michaela. It's great to be on your show. I wasn't the first to coin that phrase. Dr. Peter Wybrow, who's the head of neuroscience at UCLA, was the first to call it electronic cocaine. And then actually researchers out of China started calling it digital heroin. And then my friend and colleague, Dr. Andrew Doan from the US Pentagon, started calling them digital pharmacia because he was researching video game addiction and was seeing the parallels with on the brain with drug addiction. And so what we're seeing is both clinical and brain imaging research that shows that excessive, and the key word here is excessive, screen usage impacts a child both neurologically and clinically in the same way that a drug does.
So you say it can affect them in their behavior, in their moods, it can affect how they interact, it can affect how they function, even their impulse control. So what are we to do, doctor? Talk to us about the idea of what research says is considered excessive.
Well, let me back up to that. So the brain imaging research over the last 3 years is showing that excessive screen usage is actually shrinking the frontal cortex. And the frontal cortex is what's responsible for, it's called the executive functioning part of the brain, and it controls our impulsivity. And impulsivity is correlated with ADHD and addiction disorders. People who don't have an ability to control their impulsivity have those underlying clinical disorders. The brain research is correlating with what we as clinicians are seeing, that kids who are hooked on screens show all the same clinical symptoms as drug addiction. And so what's a person to do in terms of recommendations? The whole thesis of my book, I'm a very pro-tech person. I'm plugged in, I've got my smartphone. The key seems to be the age of exposure, how old children are before we give them a tablet, a smartphone, an iPad. Children are very developmentally fragile, and their brains are developing in leaps and bounds at key ages. And it seems that kids that have exposure to, and the key here is interactive and hyper-arousing screens at too young of an age, seem to have certain clinical disorders that correlate with that early exposure.
So what is
too young?
So we're
recommending that. Well, and so we're recommending that the same thing that Steve Jobs did, the same thing that a lot of tech and Silicon Valley engineers do. They send their kids to Montessori schools and Waldorf schools that are non-technological until age 10. The American Academy of Pediatrics used to recommend no screen time under 2 years of age, but we're seeing that some of the research is showing that the more screen time in incremental increases, kids develop ADHD. So really the recommendation would be there's really no purpose of having a child on the screen before, my recommendation is before the age of 10. Perhaps a desktop in school usage, but certainly not an interactive, an immersive screen like an iPad or a smartphone or a video game.
But you know, doctor, the challenge is there, not all families can afford a Montessori school. Not all families are going to be able to monitor their kids 24/7, because at home you may be able to manage their screen time, but a lot of the schools are putting these devices in front of kids, especially in, you know, in some of the public schools, et cetera. I wonder if it is a realistic thing to ask in 2016. It sounds easier said than done.
So and you bring up a great point, Michaela. The schools are part of the problem. I have an opt-out letter in my book that lets parents opt out from having their kids exposed to screens in public schools, because we do have the right to have our children. I'm a parent as well. I'm a parent of 9-year-old twins, and I had to request my children's public school not expose them, not give them a Chromebook or a tablet in 3rd grade, because I know how problematic that is. One of the major problems that I talk about in my book is that schools have bought the false narrative that screens are somehow educational when there's a dearth of research. There's no research that shows any educational benefit of having a 2nd grader having an iPad. And we know that instead of being educational, we're exposing them to potentially a device that can exacerbate already vulnerable children, or children who don't have underlying emotional or psychological vulnerabilities can develop certain problems with too early, with exposure to screens at too young of an age. So I think, and some other people who are like-minded think that schools are part of the problem here.
Right. Quickly, what is a safe way to sort of wean them off? Because I imagine you're going to have some fits thrown if you suddenly confiscate that screen time, even with your 9-year-old twins.
And that tells us something. The fact that we've seen explosive, what we call mood dysregulated behavior when we take away the devices from a child, that in and of itself is telling us about how hooked the child is to that device. And we also know that because screens are hyper-arousing, they dysregulate their adrenal systems. And so it's very difficult to wean a young child off of a screen, because exactly what you said, a child is going to throw a temper tantrum. But what we know is that that's the solution. The solution is to I recommend gradually, other clinicians recommend a cold turkey digital detox, unplug the child and they recommend 4 to 6 weeks so that their adrenal system can reset, and then they can slowly integrate healthier tech usage back. If your child has crossed the line with problematic video gaming, they need to unplug. I recommend gradually cutting back their screen usage to eventually where they get to a point where they have no screen usage for a period of a few weeks. You replace that screen usage with some healthy outdoor behavior, sports, nature immersion, reading. And then you eventually develop what's called a healthy digital plan. Does that mean using the internet to do research? That's a healthier use of technology, as opposed to video gaming. And look, I've had teenagers that have had to be psychiatrically hospitalized because of their excessive video gaming. They had full-blown, what we call video game psychosis. They were in the matrix. They were in the game, and that was kids who were playing 12 to 14 hours a day, and they had crossed the line of a very serious clinical problem.
Well, Dr. Nick Kardaras, I want to thank you for joining us today, because I know this is a situation that so many families are wrestling with, and maybe this book will provide them with some support and some ideas of how they can combat it. Dr. Nick Kardaras joining us. Thank you so much.
Great,
NFL quarterback Colin Kaepernick has opened up a heated debate over whether athletes should use their status to help make a political or social point. We're going to talk